Okay, so you have just waded through all the nitty-gritty biochemistry of lipoproteins. You know, your VLDLs, your LDLs, all of that. But what's the point of knowing all that theory if we can't use it, right? Well, that's exactly what we're going to do now. We're going to translate all that complex science into real-world, actionable things you can do to lower your risk for atherosclerosis.
So before we jump into the how, let's get laser-focused on the what. What is our main mission here? It's simple. We want to lower the total number of particles that contain ApoB. Remember from your lessons, every single VLDL and LDL particle has one of these ApoB proteins. It's like its license plate. It's the sheer number of these particles that really drives the risk, because the more of them you have floating around, the higher the odds that one of them is going to smash into your artery wall and start causing trouble. Everything we talk about today is going to aim right back at this one core goal.
All right, first up, our most important pillar, how we manage our macronutrients. And this is all about preventing something I call the metabolic collision. So, what on earth is a metabolic collision? Yeah, it sounds pretty dramatic, doesn't it? Well, that's because, biochemically speaking, it really is. It's the absolute perfect storm for creating the exact particles we're trying to avoid.
This collision happens at a really specific and really dangerous intersection. It's what happens when you have high levels of insulin, which you get from eating a lot of carbs, at the exact same time you have a lot of fats or lipids available. When those two things happen together, your liver basically gets the signal to go into overdrive, and it starts pumping out VLDL particles like there's no tomorrow.
So how do we dodge this pileup? Well, the single most powerful thing we can do is cut back on simple sugars. When you flood your liver with glucose and fructose, it kicks off a process called de novo lipogenesis, which is just a fancy way of saying making new fat from scratch. This brand new fat has to go somewhere, so the liver packages it into VLDL particles and ships them out into your bloodstream, which is why your triglycerides go up. So the big takeaway here is simple. If you reduce the sugar, you're literally taking away the raw materials your liver needs to build these ApoB particles in the first place. Less VLDL means less LDL down the line. It's that direct.
And that brings us to the other half of that collision, dietary fats. Now, we've all heard that saturated fat is bad, right? But the biochemistry tells us something way more interesting. Context is everything. Saturated fat is at its most dangerous when it's part of that metabolic collision, when you're eating it with a bunch of sugar and spiking your insulin. Now, on the other hand, monounsaturated fats, the kind you find in olive oil, avocados, and nuts, are pretty much a clear win. They tend to help your lipoprotein ratios and are just more stable, meaning they're less likely to get oxidized and cause damage.
Okay, so Pillar 1 was all about making fewer of the bad guy particles. Pillar 2 is about getting rid of the ones that are already there. We need to boost our clearance systems. Think of this as calling in the cleanup crew.
And one of the coolest tools for the cleanup crew is soluble fiber. Just look at how this works. It's so elegant. So first, you eat some fiber. Think oats, beans, that kind of stuff. It gets down into your intestine and basically grabs on to bile acids. Second, because the fiber has a hold of this bile, it gets carried out of your body instead of getting reabsorbed. Now here's the genius part. Your liver says, hey, I need to make more bile. And what's the main ingredient for bile? Cholesterol. So in step 3, your liver puts out more LDL receptors and literally starts yanking LDL particles out of your blood to restock its supply. And the final result? Your blood LDL levels go down. It's a beautiful, indirect, but super effective mechanism.
Now, for another clever trick in our cleanup arsenal, I call these the imposter cholesterols. They're officially called plant sterols or phytosterols. And if you look at them chemically, they look a lot like cholesterol. So when they're down in your intestine, they basically get in line to be absorbed and compete with actual cholesterol for a spot in the transport shuttles called missiles.
The benefit is pretty straightforward, but really powerful. By playing the role of the imposter, these plant sterols physically block the gate, so less cholesterol gets absorbed into your system. And this isn't just about the cholesterol you eat. It also blocks the cholesterol that was in your bile from getting reabsorbed, so it works hand in hand with soluble fiber. It's a really nice 1-2 punch. Okay, on to our final pillar, using specific supplements. Now, we have to be really careful about how we frame this. This is not about popping a pill to make up for a bad diet. This is about using very specific tools to fine-tune certain metabolic pathways for that extra bit of protection. I really want to let this idea sink in for a second because it's so important. Supplements should be viewed as metabolic tuners rather than replacements for a real food foundation. They are precision instruments. Pillars 1 and 2, your diet, that's the foundation. This third pillar, this is the fine-tuning.
So let's look at 3 of these key tuners. First, omega-3s.
At the right dose, they are fantastic at lowering triglycerides because they go straight to the source and tell the liver to just secrete less VLDL. Pretty cool. Next up, Coenzyme Q10. Now this is really important for anyone taking a statin drug. Statins block a pathway that makes cholesterol, but that same pathway also makes CoQ10, which are mitochondria need for energy. So supplementing with CoQ10 can help with some of those muscle-related side effects. And finally, there's Berberine. This one is fascinating. It actually works by telling the liver to put out more LDL receptors, the very same thing that fiber does indirectly. This makes it a really powerful option for some people.
So we've covered a lot of ground here. From food to fiber to supplements, let's pull all these threads together now and look at the big picture, the unified strategy.
So here it is, your atherosclerosis reduction toolkit. Number 1, manage your macros to avoid that metabolic collision. Keep high insulin and high-fat environments separate. Number 2, boost your cholesterol cleanup crew with soluble fiber and plant sterols. Number 3, think about using targeted supplements as those precision metabolic tuners. And through it all, never forget the one goal that ties everything together. Get that total number of ApoB-containing particles down.
So I'll leave you with a final thought experiment to really lock this all in. Thinking about the actual biochemical pathways we just walked through, which single change do you think offers a more direct, more immediate route to lowering your total ApoB particle number? Taking a sugary soda out of your diet or adding a high-fiber food in? There's no trick. Just think through the mechanisms and you'll have a much deeper feel for how all this works.